Strokes. Now, strokes are very close to my heart as I have friends and family members who have suffered from different types of strokes. Thankfully, they have survived, but they are living with a disability due to having a stroke. So let's tackle first of all what actually is a stroke. Now, a stroke can be a result of a genetic disorder or poor lifestyle choices or personal or family history. But strokes are a seriously life-threatening medical condition, and what happens is the blood supply to part of the brain cuts off. Now, reports suggest that worldwide, strokes strike somebody once every 5 minutes. So if you take the UK, for example, that means over 100,000 people a year will suffer from a stroke, and obviously that number is going to be increased worldwide. Now, the most important thing is if you suspect a stroke, if you think someone's having one, and we're going to talk about the signs and symptoms of stroke later, but if you think someone is having one, you must call the emergency medical services immediately and tell them what's happened and that you think the person has had a stroke or suffering from one. Because stroke has a greater disability impact than any other chronic disease. And over 300,000 people are living with moderate to severe disabilities as a result of a stroke. And strokes can kill. And there are actually over around about 70,000 deaths due to strokes each year in the UK, which is obviously going to be increased worldwide. And worldwide, strokes is the third biggest killer after heart disease and cancer. Strokes actually account for 9% of all deaths in men and 13% of deaths in women. Now, there are two main types of strokes. The first one is when a clot blocks an artery that carries blood to the brain. Now, it could be caused because of cerebral thrombosis, which is a blood clot forming in the main artery to the brain. It could also be caused by a cerebral embolism, which is a blockage caused by a blood clot or air forms in a blood vessel somewhere else in the body, and it's carried in the bloodstream all the way to the brain. Or it could be caused by a blockage in the tiny little blood vessels deep within the brain. The second type of stroke is actually a bleed when a blood vessel bursts, causing a bleeding or a hemorrhage in the actual brain itself. Now, it could be caused when the blood vessels burst within the brain or when the blood vessel on the surface of the brain bleeds into the area between the brain and the skull. Now, sometimes blockages in the blood supply to the brain is temporary, and a person will have the symptoms of a stroke, but only for a short space of time. This is called a TIA, or sometimes referred to as a mini stroke. Now, some people can just have one TIA in their life, where others have repeated TIAs over their lifetime. Now, a TIA is a sign that part of the brain is not getting enough blood, and there is a risk of more serious strokes in the future. So, as with all types of strokes, you must always seek emergency medical treatment if this happens, immediately. So what can cause a stroke? We've touched upon this a little bit, but let's go a little bit further. So a stroke can happen with no obvious cause to people of any age. But there are known factors that increase the likelihood of actually happening to someone. Now, some of these factors are things that can't be changed, but other risks may be reduced by lifestyle changes such as stop smoking or exercising more, or by taking medication. So let's have a look at the signs and symptoms of a stroke. How can you tell if someone's actually having a stroke? How would you know when to call the emergency medical services? So signs and symptoms can include confusion, sudden headaches, numbness, not being able to use one side of the body, loss of bladder control or bowel control, and not being able to coordinate the body. The speech is going to be slurred. There might be dribbling. Now, a good way of remembering this is a mnemonic FAST, which stands for face, arms, speech, time. So let's take each one of those. F for face. Has their face fallen down on one side? Can they smile? Is it symmetrical? A for arms. Can they raise both arms up and can they keep them level? Or does one side drop and they have a weakness in one side? S for speech. Is their speech slurred? Or are they having trouble speaking? Are they dribbling? T for time. You must call the emergency medical services if you see any of these signs. The first sign that someone is having a stroke can be very sudden, but the more quickly you identify that someone is having a stroke, then the sooner they're going to receive medical treatment, which means that more of the brain can be saved, allowing that person, that patient, to have a much better chance of recovery. Now, the care you give to the patient is going to be to help them onto the floor and place them into the recovery position on their affected side. You've got to keep them nice and warm, so cover them with a blanket, keep them nice and calm, and try and keep other people away, because it's quite a traumatic thing for the other people watching, but also for the casualty who can be scared. So try and keep onlookers away. Losing bladder or bowel control is also quite common, so do try your best to protect their dignity at all times. Now, dealing with someone who is having a stroke can be a very upsetting and traumatic experience for the first aider, so be aware of this and get help yourself. Talk to friends, family members or medical professionals if you need any help. Now, have a look at your notes you made at the beginning of this video. Can you add any more to it? Do you have a better understanding now of what a stroke is? Just want to mention one more thing, however. The signs and symptoms of stroke can be confused with other types of illnesses as well. Such as if someone can't hold their arms up, maybe they've had a previous fall and they've broken their arm. If someone's slurring their words at you, it could be because they're under the influence of drugs or alcohol, or maybe they're diabetic having a hypo. But if you're ever in doubt, you're always going to call the emergency medical services, because the sooner you get that person help, the better chance they have of recovery. Thanks for listening, guys. Make sure you hit that subscribe button